Dr. Cohen, people, and especially I think adults, sometimes are a little bit concerned and worried whether they will have a slurred speech when they have those braces on it. What's your take on that?
In most instances, we don't have much, if any, speech impact. When people wear Invisaligns or things like that, sometimes there's a little bit of a handicap for a few days until you get used to it. There are some appliances that we use in our older patients, in our younger patients that do the width change and length change of the jaw structures that can at times cause some difficulty. But we find that the majority of people, especially the younger patients, if you give them some time within 4 or 5 days, they get used to having what's in there. It usually is easier for the kids than it is for the parents. The parents always have a lot more difficulty with it, and it's not even in their mouths. But the appliances we use, in some instances, can cause a little bit of speech difficulty, but it's usually the ones that we're doing huge corrections that we have to have appliances in that are near the tongue area.
And they stay forever, or they go away after a week or two or whatever?
Oh, no.
Speech difficulties.
Most of our patients, once they have their appliances in, usually within 3 or 4 days, they're pretty well used to it. They have very little residual from it. And then once the appliances are removed, usually 4, 5, 6 months later, they have absolutely no recurrence of it.
Okay. All right. So it just simply shouldn't be a concern.
No, it shouldn't.
Thank you very much.